Welcome back and welcome to Wellness Wednesday. Grilling hot dogs, spending time in the sun, enjoying fireworks, all summer activities, but also activities that can be dangerous. All can cause burns. Amy Spangler, certified pediatric nurse practitioner for ProMedica, joins us this morning with preventing and treating summertime burns. You work in urgent care, so you probably see these types of injuries all the time, huh?
Yes, we do, unfortunately.
Yeah, so this is the time of year we want to raise some awareness. 4th of July is just a few days away. So first of all, let's talk about the different levels of burns that we can receive, you know, everything from what, 2nd to 4th.
Generally, we consider 3 degrees of burns. Initially, you have 1st-degree burn, which is more like your typical sunburn, just some redness and irritation to the skin. 2nd-degree burns are where you see blisters occurring, and certainly you can have sunburns that have 2nd-degree burns, but other materials too can cause 2nd-degree burns. And then 3rd-degree burns are full-thickness burns, which go all the way through down to bone. The other thing that's important to remember is that things that cause more minor burns in adults can cause severe injuries in children. One example is, you know, kids will frequently say their bathwater is hot. It's hot. I don't want to get in. It's hot. Because truly to them, it does feel much warmer. And even temperatures that are, you know, 105 degrees, hot tub temperatures, can injure the skin of small children. So obviously anything that can lengthen the duration of exposure of the injurious agent, and the lower the temperature, the less severe the injury. But things that won't injure adults can certainly injure children.
That's good to keep in mind. I know my 4-year-old does that too. Mom, the water's hot. I'm like, what are you talking about? You know, but yeah, her skin hasn't toughened up quite as much as mine has as I'm getting older. So just something to keep in mind with that. But you know, what if we do have a kid at home, maybe is, you know, maybe playing with a firework, or even gets their hands on the kitchen stove or next to some boiling water? At what point do we need to bring kids in or adults in to get those burns treated?
I think initially the first thing to do, I always say, is not to panic. You do have a little bit of time to evaluate. Obviously, if the burn is involving anything on the face or the respiratory tract, that's the time that you would want to contact 911 and not fool around and try to make that judgment. But if it's an extremity, you know, a hand or a foot, you certainly have time to immerse say it's a hand. You can put that hand in cool water. We say not ice water. Ice is a thermal injury as well, and so you want more of a neutral temperature. But when you have a 2nd or 3rd degree burn, or 2nd degree in particular, which are probably more common, it's very painful because the protective layer of the skin is burned off and the nerve endings are exposed. So when you submerge that sort of burn in water, it actually makes it feel a lot better. So we usually, you know, try to cool the temperature down a little bit, but again, don't use ice, and then submerge, clean the area, especially if there was any contamination, and then take a look. It's usually okay to give some Tylenol or Motrin for discomfort, and then kind of evaluate how things are going.
How do we keep those burns clean? You know, is there a good way to maybe use gauze or something? What kind of material should we be using for that?
Generally, regular antibacterial soap and water are great for cleaning, but then even just a white cotton t-shirt or a white cotton sock over a larger area is fine. If you want to use a little antibacterial ointment and cover with a Band-Aid, if you can do that. But if the area is a little bit larger or irregular shaped, if you have just a nice clean white garment, that works pretty well too.
And what can families be doing right now to prevent these types of injuries from happening in the beginning?
I think one thing is really following the directions that come with every firework, and making sure that people who are not inebriated or under the influence of drugs are the people who are supervising the fireworks. Most of the time when we see injuries, people aren't using them according to how they're supposed to be used. Relighting too young of children, or doing too many fireworks at the same time, you know, making those kind of common sense errors. And if you just take a moment to think about, you know, what the potential problems could be, we can prevent a lot of those injuries. Little kids, though, commonly will reach out and grab fireworks, and so it's really just important for parents to remember that they don't tend to let go as quickly as what we do. And so, keeping those things away from really where they can grab them is the most important thing.
A lot of those, we have the professionals doing the show, so maybe the best thing for the kids is to watch from a safe distance and watch a great show too.
Of course, that's my opinion. But.
All right. Thank you so much for joining us this morning. We appreciate it.
Thank you so much.
Yep, take care.